welcome. We will be talking about understanding stroke and TPA treatment. Little quick overview. Stroke events encompass ischemic and hemorrhagic strokes, with ischemic strokes involving blood clot formation that obstructs cerebral blood flow. TPA tissue, which is tissue plasminogen activators, are crucial treatment for ischemic strokes. TPA acts at the cellular and molecular levels, activating plasminogen to plasmin, and a protease that dissolves fibrin and clot. This clot-busting mechanism restores blood flow to the brain, preventing further damage. Understanding the structure, function, relationship of TPA and its molecular mechanism provides insights into its efficacy in treating ischemic strokes. Despite its benefits, TPA administration requires careful consideration due to its narrow therapeutic window. Overall, TPA stands as a vital intervention in managing ischemic strokes, significantly improving patient outcomes. So yay. So ischemic and hemorrhagic strokes are distinct cerebral vascular events with different underlying causes and consequences. Ischemic strokes, accounting for the majority of cases, result from blood clot formation that obstructs blood vessels supplying the brain. This clot-related obstruction leads to the reduced blood flow, causing damage to brain tissues. In contrast, hemorrhagic strokes occur when blood vessels rupture, leading to bleeding within or around the brain. The differentiation between these two types is crucial for accurate diagnosis and appropriate treatment strategies. Understanding the unique characteristics of ischemic and hemorrhagic strokes is essential in guiding medical interventions and improving patient outcomes. The mechanism of an ischemic stroke revolves around the formation of blood clots that impede the normal blood flow into the brain. Typically, this process initiates with the development of a blood clot, often in small vessels supplying the brain. The clot obstructs the vessel, causing a reduction or complete cessation of blood flow to a specific part of the brain. The lack of oxygen and nutrients triggers cellular damage, leading to the manifestation of stroke symptoms. Understanding the intricacies of clot formation and its impact on cerebral blood flow is crucial for devising effective interventions aimed at minimizing brain damage and improving patient outcomes during an ischemic stroke. The process of blood clot formation plays a central role in the onset of ischemic strokes. It begins with the activation of platelets, small cell fragments in the blood in response to vessel injury or dysfunction. Activated platelets adhere to the damaged site and release chemicals that attract more platelets. This aggregation forms a plug known as a platelet plug, which temporarily seals small breaks in blood vessels. Subsequently, the coagulation cascade is initiated, involving the conversion of fibrinogen into fibrin. Thread-like protein. Fibrin strands weave through the platelet plug, solidifying it into a more stable blood clot. This process, while crucial for wound healing, becomes problematic in the context of ischemic strokes when clots form within cerebral vessels. The resultant blood clot obstructs blood flow to specific regions of the brain, leading to ischemia and cellular damage. Understanding the intricacies of platelet activation and fibrin formation sheds light on the mechanisms underlying ischemic strokes and informs potential therapeutic strategies aimed at preventing or treating clot-related cerebrovascular events. TPA, or tissue plasminogen activator, stands as a pivotal clot-busting agent in the treatment of ischemic strokes. This enzyme is naturally present in the body and plays a crucial role in fibrinolysis. I don't know how to pronounce it. The process of breaking down blood clots. In the context of ischemic strokes, TPA is administered as a medication to accelerate the dissolution of the obstructive blood clot within cerebral vessels. The key function of TPA lies in its ability to convert plasminogen in inactive precursor into plasmin, a powerful protease that specifically degrades fibrin, the protein forming the structure of blood clots. By activating the fibrinolytic system, TPA promotes the targeted breakdown of the clot, thereby restoring blood flow to the affected area of the brain. This introduction to TPA underscores its significance as a therapeutic intervention, emphasizing its role in mitigating the consequences of ischemic strokes by promptly addressing the underlying clot formation. The molecular structure of TPA holds the key to its remarkable role in the breakdown of blood clots during ischemic strokes. TPA is a glycoprotein with a complex three-dimensional structure. Its active site, crucial for catalyzing clot dissolution, is intricately shaped to interact specifically with plasminogen, initiating the fibrinolytic cascade. The structure of TPA allows it to bind to plasminogen, triggering a conformational change in the latter. This activation transforms plasminogen into its active form, plasmin, which acts as a potent protease. Plasmin, in turn, targets and degrades fibrin, the structural component of blood clots, leading to their efficient dissolution. Understanding the molecular architecture of TPA provides insights into its specificity and selectivity in promoting clot breakdown. This structural knowledge is fundamental in designing therapeutic strategies that harness the clot-busting potential of TPA for the effective treatment of ischemic strokes. The activation of TPA is a critical step in its clot-busting function during the treatment of ischemic strokes. TPA operates as a catalyst, specifically activating plasminogen, an inactive precursor into plasmin, a potent protease responsible for breaking down fibrin within blood clots. As aforementioned, upon administration, TPA binds to plasminogen, including a conformational change in the latter. This conformational shift exposes a site on plasminogen that allows TPA to interact with the cleave-specific peptide bonds. The cleavage activates plasminogen, turning into plasmin, which that also was stated. TPA and clot dissolution dissolving blood clots is a pivotal mechanism in restoring blood flow to the brain during ischemic strokes. Following its activation, TPA orchestrates a sequence of events that efficiently breaks down the obstructive clot, which is binding to fibrin, plasmin activation, fibrin degradation, clot dissolution, and the restoration of blood flow. The cellular action of TPA extends beyond its role in clot dissolution, involving interactions with endothelial cells to promote fibrinolysis and prevent clot reformation, which is binding to endothelial cells, plasminogen activation, fibrinolysis promotion, preventing clot reformation, and enhanced blood flow. And then delving into the molecular mechanism of TPA unveils a sequence of intricate events involving TPA, plasminogen, and fibrin, crucial for efficient clot breakdown during ischemic strokes, which is the TPA binding to the plasminogen, the activation of plasminogen, plasmin activity on fibrinolysis, in fact, fragmentation and clot dissolution. As we assess the role of TPA in ischemic stroke treatment, understanding its efficacy and associated consideration is crucial. It is important to consider the efficacy, the narrow therapeutic window, risk-benefit assessment, patient selection, and multidisciplinary approach. And that is all. In conclusion, I think understanding the cellular and molecular aspects of stroke events and TPA treatment is crucial. Ischemic strokes involve clot formation, and TPA, with its unique structure, which activates the fibrinolytic system, dissolving clots at both the cellular and molecular levels. This breakthrough treatment has significantly improved outcomes for patients experiencing ischemic strokes. And thank you for your attention. And yeah, the end. Bye.